with a warm-up. How many of you recognize the baby in the picture? Yes. It's me, Zainab Al-Harith, and I'm a dentist from Saudi Arabia. And today I'm going to talk about children oral health status in Kingdom of Saudi Arabia. So let's talk about some country demographics. The population of Saudi Arabia in 2020 estimated to be 48 million. And we have 18,132 registered dentists. And the ratio of the dentist to population is a 1 dentist for 7,690. And I believe that this is a big issue according to, since the international recommendation is 1 dentist for 1,700 patients. So how is the oral health status in Saudi Arabia? Childhood dental caries in Saudi Arabia is a serious dental problem, and I believe that it's need a big attention and care from the government. So the numbers that I'm going to read to you is based on a study that was published in 2012 by Daniel Ajeli, and I believe that the numbers is gonna shock you, but I've been reading and searching for another studies that contradict Al-Ajeli's numbers, but unfortunately I couldn't find. So the prevalence of dental caries in children in Saudi Arabia was 80% for the primary dentition and 70% for children's permanent dentition. Since I earned my bachelor degree from Riyadh, I felt that I have to focus more in Riyadh. And to those who don't know anything about Riyadh, Riyadh is the capital city of Saudi Arabia and one of its biggest cities. And it's located in the heart of the kingdom. So the number that you see is based on other studies that published on 16 of July 2019 by Mohammed Rafi and his group. So what did Mohammed Rafi and his group did is examine children, school children from 75 school in both urban and rural areas of Riyadh, and they basically divide the children into 3 groups: 6 years a group, and 12 years a group, and 15 years a group, and they come up with these numbers. So the caries prevalence was 85.77 in the 6 years a group, for 64.98% in 12 years group, and 71.35 in the 15 years group. So both caries rate and severity were higher in a rural area rather than urban area, although the difference were not statistically significant. So what's the barriers to dental care in Saudi Arabia? One of the most and biggest barriers to dental care in Saudi Arabia, and I believe it's all around the world, not only in Saudi Arabia, is it's a baby teeth. Why I have to treat it? In other words, lack of oral health education, local and lack of receiving need, fear of dental treatment. Another most common barrier is the time that take them to have a dental appointment in the government clinic is long, like usually take you 1 to 2 months to have appointments, as well as the unaffordable prices in the private clinics. So the government did a lot of efforts to reduce the number of children dental caries. So there is a free public oral health care available to everyone. We have more than 2,280 public and private dental clinics distributed all around the Kingdom of Saudi Arabia. So in Riyadh specifically, we have 240 public uh, clinics, 336 private clinics, total of 576 clinics. I believe from these numbers that in Saudi Arabia, we have some discrepancy where most of the dentists saturated in the kingdom, in the big cities of the kingdom, such as Riyadh. So the people who are living in these big cities seeking treatment most frequently than others. Um, did the government do anything to face this discrepancy? So in 2018, the government of Saudi Arabia started the National Initiative for Prevention of Dental Caries. It's basically educational aspect, prevention application, and some remodeling measurement for primary school students in the both government and private school. So the target of the initiative is students in the primary school. Um, so what its components? It's basically like 1 day activity where the children's in the primary school have awareness lectures, then a training on using toothbrush application, typical fluoride application, and examining student tooth, and then referring them to seek a treatment. Um, the initiative aims are raising the level of health awareness among students about their teeth and the importance of keeping them healthy. Provide students with skills to prevent from dental disease, activating the role of educational careers in participating in promotion or promoting oral and dental health, involve the family, instilling health behavior among the young, and achieve national goal to reduce the incidence of dental caries by categories, age, and approval ratio. So unfortunately, I don't have any data to show to you, so we can compare if this efforts have did something good or not. But from the achievements and the numbers, I do believe that they that it did a very good job in reducing the children's dental caries. The numbers of students that beneficial from the education and lectures is exceed million student, and there is around 5,000 school participating, and a half of million of the students use now are using a toothbrush in the schools. So I believe that this is a big compliment. So if you ask me what I have from my experience in UCLA, what I have to take home and to participate in reducing the oral reducing dental caries in Saudi Arabia. Um, I will tell you that infant oral clinic, one of my biggest favorite clinic and rotation. I believe if we implement this change in Saudi Arabia, where children can go and see the dentist from early age, this will help them to reduce the number of dental caries, um, and ASD rotations as well. I believe that we have a lot of autism patients in Saudi Arabia, and the dentists were afraid to treat them because they don't know how to treat them and how to handle the situations. So I believe if we implement these two changes, um, we will do a very good very good I mean, like, we will reduce the number of dental caries in Saudi Arabia. So this is all of what I have about oral health status in Saudi Arabia. I hope that one day some dentists from Saudi Arabia can present you satisfactory numbers.
Well, thank you. Thank you. That's very, very nice presentation, very nicely done. I want to open now if you have any questions. I do have a question because it seems for us that we have in mind that Saudi Arabia, there are kind of well-off people, that there's no poverty, that there's no vulnerable communities or populations, that there's not really issues of access to care. But I think I might be very wrong, because I know there's a lot of maybe refugees or migrant people. Or can you tell us about what is the access to care there, and are there any vulnerable communities that we should really focus when you guys go back there, that you should really try to focus on the whole message of early prevention, early intervention of the H1 visit?
So in Saudi Arabia, we have a governmental clinic where they offer a free treatment for everyone, not only for citizens, also for non-Saudis population. So everyone seek treatment. I do believe that we have to focus more in rural areas. Although there is a lot of clinics, governmental clinics, but I do believe that people still need to be educated, because like around 80% of parents, they don't do any efforts. They don't like follow up with a dentist or something unless their children's need treatment. So I feel that we have to focus on education, like there is in oral care clinics where we educate pregnant women how to take care of their baby's teeth and all this stuff. I do believe that people in Saudi Arabia still need to be educated more.
Thank you so much, Zainab, for sharing. It was really remarkable, especially, by like standards in the US, like pretty much the entire kingdom is in a health provider shortage area. And so in terms, I guess I have like a couple questions. So the first is like training. Like there's obviously a shortage of dentists. Are schools there training enough dentists, but people seek employment elsewhere because maybe it's more lucrative outside of the country?
We have like around 28 dental schools in Saudi Arabia. And I do believe that every school graduate like around 6,000 dentists. But I don't know how most of them, they want to continue their studies or having a very good job in a clinic where they have a big salary, so they don't want to practice in a governmental clinics or something where the salary is not high as they need. So maybe this is one of the biggest issue that we have.
Yeah. And then maybe I missed it. I know you mentioned, like the government clinics throughout the country. Folks that want to, is there like a private insurance system, or is it just out of pocket if they want to see a different dentist?
like in the governmental clinic, it's free. So, but if they want to go to a private clinic, because it will take them too long to have a dental appointment in the governmental, they will pay for their treatment in a private clinic. So we don't have like an insurance.
Okay.
But I believe that the government of Saudi Arabia is working on giving health insurance for everyone. So if you will not be able to go to the governmental clinics, you can go to private, where still the government can pay you.
Excellent.
Sean, it seems like Sean, it seems like it's like many countries in the world that they have some sort of a basic health coverage for all. It's kind of basic depending their income per capita, but it's very basic. So obviously, whoever is more affluent and has the money in their pocketbook to go and pay for private dentists or private doctors, they will go and seek and do it.
Gotcha.
Maybe for the faster track of being seen, and also it's been sort of assumed that they can maybe be getting better care in private practices if you pay cash money directly.
Sure. Yeah, Zainab, I think you're totally right too about the impact that like a program like IOCP can have on a population or a country where there's a shortage of providers and there's like a really high caries rate. Like doing those early educational interventions and kind of normalizing and educating parents and families about the importance of like seeing a dentist regularly. So I mean, that would be amazing if you could implement that and really see like the true impact, kind of starting from scratch almost. So that's awesome.
Yeah, I hope so. I can do something because the numbers is really shocked. I didn't expect that the numbers reached to 80%. That's like make me like sad and want to do something. So I hope that I can go back and do something.
Do you think you'd try to collaborate with the government? Do people take that route a lot?
I'm not really sure, but
why not? You should answer why not. Yes, I mean,
yeah,
you're like an expert now.
I
You can
love,
meet with the Ministry of Health. You can meet. Yes, you can.
Yeah.
Yeah, but like it's gonna take a while, but I will do my best.
You took a class on advocacy and policy development, so you are prepared to go for it. So
for sure. And I guess this is like my own ignorance too. What is the role that women typically play in government organizations? Like, would it be atypical for you as a woman to be like starting a big program, running a program, and like kind of being like a minister in that sense?
Yeah, you have to have approval for it, of course, and like we have like to do like a union or something to implement changes, and that's need to be you have to like to have someone who have a really good communications, so they will open you the doors to go and ask for these changes.
yeah, but I think he's referring, Zainab, I think he's referring mainly about if women have opportunities to be in positions of power in the Ministry of Health and others, and I think they do have, right? There's no
Yes.
gender discrimination at all to get those jobs, as long as you have the expertise, the knowledge, the background, the curriculum to show that you're better off than the other ones. They'll get you from the pool regardless of your gender, correct?
Okay.
I think
that's helpful. Yeah, I guess if that route was going to be too difficult, like exploring the options of like starting like an NGO or something like that to try to implement the program.
I think they're very advanced, and maybe since Noor, she's already there, she can tell us and give us an update on how things are right now, especially she was abroad and overseas for a while.
Yes, of course. Yeah.
Request remote controls. I know I don't need to request. So yes, so maybe Noor, thank you. I thank you for getting up in the middle of the night. We're very appreciative. I'm so sorry to have you. I don't even want to ask what time is it over there, but thank you for joining us so late.
It's okay. It's just 11:30 p.m. It's okay. I don't sleep early.
We miss you, Noor. So maybe before you start, can you tell us about your impressions after being away in the US for a while and coming back? I know that many things have happened, and I think people are very eager to know if women have better rights, are they in better positions, possibilities. Did you notice any changes, especially on gender equity and how women are being really developed there since you left?
Yeah, there's of course a difference from the last decades that women can have their rights here in Saudi Arabia, especially in these last 5 years. They started to have all their rights as everywhere, and they getting the best jobs here. They started to drive a cars. They started to have everything they want. So I think there's no difference from elsewhere.
So
That's
that
awesome.
was surprising for you to see. Are you driving now? Are other women driving? Is it surprising
Yeah,
for you to
sure.
see that?
Yeah, sure.
I bet you that there are better women drivers than men drivers. There'll be less accidents, maybe.
There is some of them. There is some not.
It's part of being human beings, anyways, regardless
Yeah.
of gender.
Yeah.
So, are you driving now?
Yeah. I'm the one of the first who drives here.
Oh my God, fantastic! You're so westernized now.
Yeah.
You're very, very good influence. We're also happy and proud of you. We miss you, Noor. We miss you, Noor.
I miss you too. I'm missing going back there, and I'm missing being in this program. Really.
Mm-hmm.
Come visit.
I hope so when they open the airport.
Yeah.
Yeah, they're so close.
How is the status of cases there? What's happening with cases?
There's no difference. It's getting worse, but there's nothing we can do.
I think it's
Yeah,
getting
but-
worse I think it's getting worse everywhere in the world as well, here in the US. So it's very sad. It's very
The
humble.
the government can't do anything else. They stopped the outbreak here. Everything is now is open. It depends on the people how they will deal with it. So we'll see later on what will happen.
Very
So I'm
good.
now gonna share my screen.
Yes, please share your screen.
For the presentation.
I'm looking forward to that. Vanessa, do you need to share the screen with Noor?
If she needs me to, I could share her presentation.
Okay.
Oh, I think she has it.
Yes, she's got it.
There you go.
Excellent. Thank you.
Okay.
I think that maybe if you put it in the slideshow, because right now we're seeing all your different slides on the screen. I think you need to put in like slideshow, I believe. Yes.
There you go.
Yeah, thank you.
Because I need to see my notes, so can I open my phone? So I think Zainab have said everything, but I hope to output some points that she didn't mention in my presentation. So I'm also gonna talk about pediatric dentistry in Saudi Arabia. Next. How to put next? Well, I think I'm out now, right?
Yes, I think that if you go to slideshow and just move, there's like a little arrow below. If you look at your left side corner, yes, right there, you can move them from there.
Okay,
Yes,
great.
it's moving now.
So first of all, I'm gonna talk a little bit about Saudi Arabia. Kingdom of Saudi Arabia is located in Western Asia. The population of Saudi Arabia is estimated to be 34.1 million. The Kingdom of Saudi Arabia capital is Riyadh. Also, Saudi Arabia geography is diverse with forests, grasslands, mountain ranges, and deserts. It is also the world's largest exporters of petroleum liquids and relies on the oil industry, of course. Saudi Arabia is the birthplace of Islam and home of Islam's two holiest shrines in Mecca and Medina. Dentistry in Saudi Arabia. There are 28 dental schools in Saudi Arabia, of which 20 are public and 8 are private. Studying dentistry in Saudi Arabia is 7 years in total. The first 2 years focusing on basic science, for example, biology, biochemistry, microbiology, and physics, and so on. The third year is going to be preclinical and laboratory courses and introduction for every dental subject. The fourth, fifth, and sixth years is mostly and mainly clinical work, and the last year, the seventh year, is an internship where whereas the students works as a general dentist, where they can do a general primary treatment care. Dentists to population ratio, we have one dentist for 1,880 persons, and which is a good rate. But the problem that we have, that most of the licensed dentists in the kingdom are general dentists, which is 70%. Pediatric dentistry in Saudi Arabia. Specialized in Saudi Arabia is different from elsewhere. It is strictly clinical, and you have to enroll in a program. And it is not only a test that you take after finishing your residency or specialty program. It is a 4-year in length, and it is a highly competitive program because of the life size of the accredited Saudi Commission for Health Specialist Residency Program in Saudi Arabia, where very limited number of dentists can join to the program. The Saudi Board of Pediatric Dentistry started in 2005, and shockingly, the percentage of female pedodontists is slightly but significantly higher than in male dentists. Now I'm going to talk about the oral health status in Saudi Arabia. Oral health status in Saudi Arabia, in Saudi Arabia, the prevalence of dental caries among children range from medium to high. That means there is an immediate need of attention and care for oral health in Saudi Arabia. There the numbers will shock you right now, because it's so slightly high. And primary dentition of children under 6 years old range from 63 to 99%. And in the permanent dentition, the prevalence range from 56.7 to 99%. Which is very high and still very common. Improvement of preventive measures of early age should be emphasized by parents and dental health professionals, and more attention is required for non-working parents, telling them about the risk dental caries affecting their children and awareness of preventive care of dental health. Having said that, there is a free public oral health or oral care available to all, and there's a significant numbers of a private dental clinic in Saudi Arabia. But most of these clinics are situated in the big cities, so people usually seek treatment in those cities. For the rest, rural cities, it's hard to them to go to commute to these clinics to have the oral health care. Some of the barriers to dental care, the first and the most one is the lack of oral health education, especially in the rural population, and the mentality of I don't need to go to the dentist as long as I don't have pain. Also, fear of dental care, and the third thing that there is some cultural factors related to oral hygiene practices and dietary habits. We have something that's called miswak. It's a comment that as you can see in the picture, the people use it to clean their teeth with it. It have been shown a good result of removing the dental plaque, but most of the people rely on it, and children started to copy them on using this kind of dental cleaning, and also insufficient public health rule. But in my opinion, nowadays people started to get more educated, and from the applications, some of the applications, as Zainab said, and from the some of the social applications, that people know more about how to take care of their teeth, and which is become more proved in Saudi Arabia. Lastly, last words I want to say for the UCLA Pediatric Dentistry team. I want just to say thank you for this great experience, where I have gained a lot of knowledge about minimally invasive treatment, and enjoyed the infant oral care rotation, where I learned about a lot about prevention of early childhood caries, and my favorite rotation in craniofacial clinic, which was so unique and lighting my mind on a lot of information. And I really want to put this back to Saudi Arabia, which we are like to this kind of clinics. Lastly, thank you for all the ministers. Thank you, Dr. Ramaz, and the pediatric residents that I met and learned from. Thank you so much.
Well, thank you. We're so thrilled and happy of such a nice presentation and your presence with us. We miss you always. And, for us, it's a total reminder that we live in such a global village, right? That whatever happens to you affects us all. So this is such an important message. For me, one of the highlights of the program, of course, obviously, besides the residence, is to have this incredible opportunity with the HCTs. That brings a very amazing and incredible opportunity for a global experience. So having said that, one of the things that we've always been very concerned and appalled is on the high rates of early childhood care, especially in Saudi Arabia, and even though it's a high income communities. The idea is that perhaps the parents really want to give a lot of sweets. So they what's the word? Do they maybe moderate behavior of the children with incentivizing with sugars early on? I mean, is it something that it's a common culturally used, like in other countries, to actually praise children with sugary foods or snacks or candy, or what is it? Why is it such a huge prevalence, especially with high-income families there? Is nutrition like a big issue or focus or factor?
Yeah, because mostly is the lack of education. Parents don't know when they have to start brushing kids' teeth. They usually here they started to brush their kids' teeth from 3 years old, and also we have some kind of sugars. I don't know if you know what the dates. It's so common here, and you can see it everywhere, which is one of the most factors that the children and the older people eat it here.
It's like the sticky dry fruits, right? That sticky date, or
Yeah.
some racist
So
and
this
things.
is one of the bad things, and mostly is the lack of education of the parents.
Our mothers
We don't have, yeah, we don't have like the OACP clinics here in Saudi Arabia. So most of the parents, they don't know any information about how to take care of baby teeth. They think that it is a baby teeth and they will fall down, and the parent will come, and since this they started to brush the kids' teeth.
our mothers used to breastfeed uh,
Yeah, yeah,
all,
yeah.
until older the child is. I mean, what is the average of breastfeeding? Is that still something they used to breastfeed at 2, 3, 4 years of age? Is that something that's common?
I think until 2 years, until they're still using breastfeeding until 2 years old. Yeah.
They don't wipe the teeth. That the baby sleeps on the breast and things like
Yeah,
that.
they sleep on the breast, and they sleep at night with it. So this is the biggest problem here also.
So it's also happening to highly educated parents and mothers. I mean, even though they're highly educated, there's no awareness about oral health prevention. Is it something like they already think, oh, we're doomed? It's part of the nature of children. We're going to have cavities regardless. Is it something?
Yeah. It used to be like this, but nowadays they're starting to know of these things nowadays. So I can see some changes here. People are taking more care of their kids' teeth. Yeah, but it used to be like this. Even the highly educated people, they think it's just a baby teeth, and they don't have to take care of them.
Yeah. Any questions from the residents or anyone else? Shona,
Yeah,
ask a question. Yeah.
Oh, yeah. Thanks, Noor, so much for presenting. And I guess Zainab touched on it a little bit too with rural populations. What is like internet access like in those rural communities in Saudi Arabia? Are people well connected? Have you thought about ways of like maybe trying to do like teledentistry, or have you thought of ways to try to reach these isolated communities?
I think it is still hard to, especially for the rural population. They don't have the internet communication, but with the big, like in the big cities, so it's still hard to them to get the oral health care since they live in small cities and rural places. So, but if they want to get the care, they have to commute to the big cities and have it, which is also a big problem there in Saudi Arabia. But nowadays, the government started to do more more doing more education community, and this rural population, especially in the schools, for where kids can learn. They teach them how to brush, and when they have to brush. So they started to do some of these kind of communities to improve this kind of a problem in rural population.
Gotcha. And then,
yeah. Go ahead.
oh, you're sure? So in terms of like, I guess attitudes and I guess just vanity, you know, like in the U.S., everyone's very concerned about like how their teeth look and, you know, all of these things. Is that as much of a concern in Saudi Arabia, like culturally? Like, is there an emphasis on this, like vanity or, you know, appearance, or is it not as high a priority as it is here?
Nowadays, it's become now because of the social media. Kids, they use it now a lot, and they can see that the videos and YouTube and about the teas, the songs. I think nowadays also the kids caring becoming more interesting of getting their teeth more clean. So. I don't know. I think nowadays they are becoming now more interesting in oral health care.
Awesome. Yeah, so like maybe a decent opportunity for like social media campaigns for educational materials and stuff like that.
Yeah.
Cool.
So I want to bring something back that that you mentioned, 28 dental schools, and it's not such a big country. What's happening with all these dentists? I mean, are they staying there? They go abroad, overseas? I know there's a lot of people that they're moving there to practice as well. So how come there's so many dentists and there's so much, really so much restorative need and cavities and disease?
Yeah, as Zainab said, that we have a lot of general dentists, but most of the clinics now here in Saudi Arabia, they need a specialist, like pediatric specialists or ortho specialists, and that's why like most of the dentists now trying to seek this education outside Saudi Arabia. Because the programs, residency program, the Saudi boards here in Saudi Arabia is so limited, and the number is also limited to take care of all of these dentists. So the dentists, some of them are out to get a residency program, and some of them just staying, waiting for the job there.
Very, very good. Are there any other questions or comments? Maybe starting with you now, Noor, but we'll go back to Zainab. So what are your plans? I know if I can share with others that you were selected to be interviewed for the University of Hong Kong, and I think you did a very good job on that. So what are your plans for the future, so people know that we might go to visit you in Hong Kong in the near future, correct?
Yeah, I'm still waiting for the result. They will release it in July, so I hope so. I get accepted there and practice the knowledge and experience that I have learned in UCLA there, and also after that in Saudi Arabia. So I'm still waiting. I hope so. Just pray for me.
Yeah, sending you good energy, good karma. And how's your daughter? Everyone wants to know about your daughter. We miss your daughter too.
She's sleeping now. She's sleeping in the same room. I hope she will not wake up.
I'm sure your family is very happy to see her there with you. I'm sure they miss you so much.
Yeah, thank you so much.
Thank you. Zainab, can you tell us about your future plans? Also, I forgot to ask you in your talk. I'm not sure if is she on mute? I don't see her now.
Oh, sorry. Yeah, so getting into a residency program. So I did apply to many dental schools, and I'm waiting for the results.
In the US or abroad or overseas?
Yes, in the US.
Mainly in the US. You want to come back?
Yeah, sure.
Hopefully we'll open our international program soon for us that you can come and apply for us.
I wish that.
Yes. Very good. Thank you so much. We wish you the very best for Noor.
Thank you.
Zainab, thank you for your presentations. Very interesting
Thank
about
you.
what's happening in Saudi Arabia.